Today's tutorial is on turmeric or curcumin. As I contemplate training for a big hike at the Grand Canyon, I'm well aware of the aches and pains that my athletes go through as far as getting ready for an event. So, knowing that, I always have my prescriptions for anti-inflammatories ready to go. As most of my patients know, I like to try to take advantage of nutrition and supplementation if possible. If it's necessary for an injury, then I'll use prescription anti-inflammatories with low side effects, or even pain control medicines, muscle relaxers. But for the sake of this tutorial, we're going to talk about turmeric and its power. Turmeric has been studied well in the last 10 years. The paper I wanted to cite was Janet Funk's work with turmeric and rheumatoid arthritis. And it's an excellent supplement. A lot of my patients that are from India will use it as a spice, curcumin. It has a kind of orange color to it in powder form. But note that if you take it in powder form and sprinkle it on your food, you're not getting what the studies have been shown as very strong anti-inflammatory effect. In fact, we'll just go straight for the information. My usual suggestion with turmeric, if you can find a company that is reliable, is 500 to 750 milligrams twice a day. And here's the catch though. If we're treating an inflammatory issue with the bowel, like ulcerative colitis, and you patients know who you are, then the turmeric should be taken on an empty stomach. When you take turmeric on an empty stomach, the likelihood of absorption into the bloodstream is lower, and that's where the beauty of Janet Funk's paper came in handy. If it's minimally absorbed, then it gets from the stomach to the colon. When you have an anti-inflammatory herb present to the colon, then it'll work its magic to the lining of the colon. And as I mentioned, ulcerative colitis sufferers have a lot of inflammation in the colon, so if you can present a spice or a medicine directly to the lining, then better for the patient that's suffering. So again, empty stomach if you're an ulcerative colitis sufferer. If you have rheumatoid arthritis and you want the systemic absorption to kick in, then you take turmeric with pepper. And the paper that she wrote found that when you combine turmeric and pepper together, the absorption was more guaranteed. And having technical difficulties with my strap. So the absorption was more guaranteed to get into the bloodstream. If you're trying to treat an inflammation issue like rheumatoid arthritis or muscle aches and pains, recovering from an injury, just like why I originally set forth to talk about turmeric. If I expect I'm going to be having some injuries or aches and pains to the muscles that I'm training, then I would want the turmeric to be taken on a full stomach with pepper. A full stomach with pepper and turmeric together gives more of a guarantee that it will get absorbed. If it gets absorbed into the bloodstream, then it will have an anti-inflammatory effect to hopefully the muscles and joints that I'm going to be training today. Indirectly, it will work and help for ulcerative colitis sufferers, but again, Janet Funk's paper was fantastic for finding that it helped decrease the reliance on anti-inflammatory prescription medicines in people who had rheumatoid arthritis after about 12 weeks, I believe. And in addition, it also decreased the markers of inflammation found in the bloodstream of those patients that also suffered from inflammation. So not only did it give subjective help, it also showed a decrease in blood testing for signs of inflammation. So definite potential for patients who have inflammation, arthritis, joint pain. 500 to 750 twice a day. If it's inflammation, you take it with food or with pepper. The typical dose with pepper or piperine, and you don't just get pepper, you actually have to get the derivative of pepper. Piperine is a scientific name, and it's usually 20 milligrams of pepper to 1 kilogram of turmeric. Now, if all that seems too confusing, there is a shortcut. There's something called curcumin. Curcumin is the active ingredient in turmeric that helps with its inflammation. If you can actually purchase curcumin, it sometimes, if it's absorbed properly, will work the same way as the turmeric. Again, the papers are all on turmeric and inflammation. Curcumin, there are some research papers, but it's limited. The theory is there, though, because again, if you have the byproduct of what you're looking for as far as the active ingredient in your turmeric, you go straight for that, you absorb that, then the theory is that it would help you the same way. Curcumin can be absorbed faster if it's in a bioavailable form. Now Foods has a nice bio-curcumin compound that's it's bound to, well, I'm not going to talk about the chemical structures, but it will help. It's a little more expensive, but it will help in the absorption phase of getting the curcumin through the bloodstream. It's an option if you don't want to, if you don't like the turmeric. One of the side effects of turmeric with one of my patients was that it upset her stomach. Another patient claimed that it made her feel a little bit dry after a couple of days. So everybody has their side effects, but altogether a great herb.